Hi, everyone. Thank you for joining our virtual dental shadower session. We want to remind you that in order to get your hours, you will have to take a short quiz, and as long as you get 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, let's get started. We are very fortunate to have Dr. Angelica for today's session. I am handing the mic to you. Feel free to start whenever you'd like.
Hi, thank you so much for the introduction. My name is Dr. Angelica Chaghouri, and I am currently a orthodontic resident at Tufts University. All right, let's jump in. I just want to first apologize. I live right across the street from a hospital and next door to a fire station. So if there's any noise, I'll just pause and then we'll continue. So a little bit about myself. I'm from Santa Monica, California, and I am currently presenting from Boston, Massachusetts. So the two direct opposite parts of the US. I'm a first generation American. My parents are both Lebanese and immigrated to America during the Civil War. Like I said, I'm a first year orthodontic resident at Tufts University, and I love to play beach volleyball when it's not too cold in Boston. I love to cook, spend time with family and friends, and I love to try new restaurants and work out so I could try more restaurants. This picture right here is of Santa Monica, and if you look up to the top, that's where I love to play beach volleyball with all my friends growing up. So a little bit about my education background. My undergraduate degree, I went to the University of California, Los Angeles. And then I graduated there in 2016. I actually took 2 years off on a gap year where I took extra classes to boost my GPA, especially science courses. And then I got into USC Dental School, the Herman Ostrow School of Dentistry of USC, and just graduated then from there in 2020. It was a great experience. And then I got into Orthodontic Residency, and that's where I am right now, and I will be graduating next June. So pretty excited. Towards the end of my education, and I would like to say there is a light at the end of the tunnel. I know it's a long journey, but it's been a great journey so far. So a little bit about study tips and advice on staying motivated. For me, this was really difficult in undergrad because in undergrad, you're not really learning things that are applicable to your career. You're taking these courses to get you to your career choice. So these are things that really helped me. They don't help everyone, but I just wanted to let you know of things that really were beneficial to me. So for me, I love to write out goals. I always write New Year resolution goals for the whole entire year, every year. And I always write a concise list of bullet points of how to achieve those goals. I also write goals of to-do lists, what I try to achieve every day or every week. And that really keeps me motivated and also keeps me on track. Another thing that's really important is to research how to achieve those certain goals that you set. As you could go to Googling how people achieve them, or even talking to people that have achieved those goals. I mean, those are the people that have firsthand achieved those goals, so they really helped. So for me, I always spoke to dentists and orthodontists and upperclassmen when I was in dental school of how, especially the ones that got into orthodontic residency, how to follow those footsteps and get into orthodontic residency. This next one, trick yourself to be interested. So this one was huge for me. There were some courses that I really was not interested in. It was really difficult to study for in undergrad. Those like filler courses that you have to study about different alleles. For me, that was not interesting, but that is something that I needed to do and achieve to get into dentistry. So for me, I made a game out of all of those courses, and I tried to pretend like those were like the most interesting things. I would sometimes take snacks and make a game. If I like finished a certain amount of reading, I could eat a certain amount of snacks. So like those are little things for me, and I don't know if they'll help you, but those are things that helped me. Another thing was taking breaks. I would try to tell myself that I could study 14-hour days for the DAT, but that really wasn't realistic. I would often find myself shopping online. So for me, it was taking study breaks and setting a certain amount of goals, but also setting amount of study breaks to reward yourself for studying hard. Another thing would be to do a trip. If you're not gonna if you study really hard during the week, I was taking trips sometimes just to reward myself for studying hard. And it was a good reward because that was really motivating. So things that helped me or stuff that just were creative, you just have to get creative to see what inspires you to study more. I know it's difficult, and there's a lot of times that you feel unmotivated and lost, and you're just like, especially in the beginning, you're kind of like, why am I studying so hard for this? But just keep the end goal, like, and it's very close for me too, because I'm there. So looking back, I'm so happy that I stayed on track with all those. So try to do that. I know it's difficult. So for me, we'll talk a little bit about orthodontic residency and how to get in. So these are my journeys of what I did to make sure that I became an orthodontist. I went to UCLA and I was on the D1 volleyball team for a year. And then after, I was on the club volleyball team and I was a co-president. So really in undergrad, you should be making yourself a well-rounded candidate, especially if your grades are not strong. My grades weren't strong initially. So I really wanted to make sure that I had my research and I had my extracurriculars on point. Another thing I was a part of, it was the Lebanese Social Club board member. And then I also was part of the UCLA has a pre-dental group called it's called PDSOP, Pre-Dental Student Outreach Program. And for them, I was a community service coordinator. And that was actually one of my favorite positions. And so we got to, we started this campaign called Happy Teeth Health Educator. So we'd go to middle schools in the greater Los Angeles area and teach kids oral hygiene instructions. And we pass out toothbrushes and toothpaste. And it was really rewarding and also beneficial to all these kids. So there's a lot of community service that I was doing in dental school to help myself look like a more well-rounded candidate. I shadowed a ton. So this is really good that you guys are able to attend this session because you're able to learn from people that you maybe want to follow into their career path. But I've shadowed every single general dentist I could like talk to. I heard that to get into dental school, you want to only kind of show that you want to be a general dentist because you're going to be general dentist first. But in dental school, that's when I started shadowing specialists, and that's when it really solidified me wanting to become an orthodontist. I also did volunteer research assistant at UCLA at the dental school, and that was also helpful. And then a lot of DAT prep because that was a hard test for me initially. So in dental school, that's when you become you have to also become a well-rounded candidate to become an orthodontic resident. Ortho is very difficult and it's very competitive. So really, you should kind of prepare yourself from the beginning of dental school if you want to become a specialist. You are really, so my experience at USC was not as competitive as other dental schools because other dental schools rank you. So you should, if you are at one of those dental schools, you really want to make sure your grades are on point from day one. And I know that people that had decided they want to be specialists and like year D3 or D4 had a harder time because their grades were a little bit lacking because they didn't really decide until then. And then that's when they really pursued specialty and trying hard in grades. So in dental school, I was a class of 2020 vice president my first 2 years. And then I also founded the Middle Eastern Dental Student Association. Excuse me one second. And that was we created the Smiles for Syria campaign, and we provided some free dental care to Syrian refugees displaced in Southern California. So that was a really cool experience. We also did lunch and learns and also social gatherings for all the Middle Eastern people celebrating Middle Eastern heritage as well. Oops. Oh. Sorry guys, I had to tickle my throat. Okay, so I also was the graduate student government at USC Senator all 4 years. And then I also was the Orthodontic Club co-president. So I really dove in dental school because I knew that I wanted to specialize and I really wanted to do as much as I can. I think in dental school, it's all about what you make of it. So for me, I said yes to everything. I wanted to do everything because you're spending so much money. Excuse me, one second. I need to get some water. Sorry, guys. So like I was saying, in dental school, you're spending a lot of money. So I wanted to make the most out of that situation. I wanted to be involved with everything that I can so I could learn as much as I can. You're spending a lot of money to be there. So just getting by like some other students was not for me. So that's not what I wanted to do. So one of the best experiences in dental school, and if you're in dental school, if you get into dental school, I highly recommend you attend one of the outreach programs where they go to different countries and provide free dental care to those countries. So I went to Cambodia in 2016 and they took 49 dental students and I was lucky to be one of them. And we provided, you could see this production value, over 150 or 65,000 of production value of free dental care to this community. And it's so rewarding and you learn the most in that week in that outreach than you do like that whole year in dental school. So it's a very rewarding and a great learning experience. And it brings you closer to your dental students, classmates. I also went to Nicaragua as well, and that was an amazing experience. So if you have the opportunity, it is at USC, you have to pay for it. So it is expensive. But it is really rewarding and it was one of my favorite experiences in dental school. So here are a few pictures. This first one was in Cambodia. The first two are Cambodia, and then the last one is in Nicaragua, where I was able to provide cleanings and assist and provide other dental care work. So it was a really great experience. I highly recommend it. And then other things that I did in dental school was there's a orthodontic selective, pediatric selective, special patients clinic selective. And then I shadowed a few orthodontists to really make sure that I wanted to become an orthodontist. And then I was a teaching assistant for multiple courses. And on top of that, I did research as well. I thought the teaching assistant was a great opportunity to get closer to faculty. And I was able to get a few letter of recommendations from those faculty members that I was a teacher assistant in their courses. The research we could talk about in a Q&A. I decided that I didn't want to do full-on research in dental school because of all the other extracurriculars that I was involved in. So I wrote a research article, and that was me able to get involved with research, but also not be tied down to a research lab. So we could talk about more of that, something you guys want if you're interested in. So why did I choose my specialty? What did I have trouble with? Is there any other specialty that I considered? I wanted to, so when I went to dental school, I wanted to consider every single specialty. I came into dental school with ortho being the highest, but I just wanted to make sure that I crossed out everything else and had no regrets. So I shadowed an endodontist, and that was my least favorite. So I was lucky that I could cross that one really fast. I was considering general dentistry and doing cosmetic dentistry or orthodontics because I really like the cosmetic aspect of it. And I really like how you could change someone's life at an early age and actually see them grow. So right now I have a lot of patients that I've witnessed grow within this 1 year and become really close to them. And so I know that I'm going to have a big impact in their lives. And I actually had the same experience with my orthodontist. I changed. I think I really grew as a young girl when I had my braces off. And I think that's something that I really want to do and provide to my patients. Another thing that I really like about orthodontics is that you're your own boss. It's a lot of job security. Lifestyle is good as well. And I really like how you're really changing someone's life, and you're improving someone's quality of life through braces, Invisalign, or different types of bracket systems. Something I had trouble with in dental school was doing a bunch of root canals when I knew that I was never going to do them ever again. Like I said, there's in undergrad, there's things that you have to do and that you're not interested in, but it's something that you have to do to get to where you want to be. And I think that is one of them. It's some things that you have to learn. And it was a good experience, but something that I didn't really enjoy as much. Another thing that was difficult with specialties is for me, it was taking out more loans. It is a financial burden, but it is an investment. So that's another thing. So let's dive into a little bit of ortho. So these are a few things that we use every single day. So the first one is brackets. There's so many different types of bracket systems. I had no idea before ortho, but there is a ton. There's brackets with no torque. There's brackets with different kinds of torque in them. So we use brackets every single day. The next one is those wires. We use those wires and those brackets to instigate movement and light forces. And so there's different types of wires. There's nickel titanium, there is stainless steel, there's TMA. So these are all things you'll learn about if you want to pursue orthodontics. And they're used for different things. The one on the top right is a distal end cutter. So if any of you guys had braces had braces in the past, you know that the wire tends to poke your gums. So that instrument right there is used to cut the end of it so that it doesn't happen. So we use that every day. So we make sure that our patients are comfortable and there's nothing poking before they get out of our chair. On our bottom left, that's an iTero scanner. So before we used alginate impressions to take impressions of our patient's mouth. Now we're able to take 3D imaging of them and we'll print them on a 3D printer, and so that we could have the models in our hands when we're talking to the patient and their parents about the treatment. And so it's a great tool. And right now they came out with another one that can assess caries at the same time as you're scanning. So it's really beneficial. And I actually like it way more than taking alginate impressions by far. And I think my patients do as well, most importantly. The third one, or the middle bottom one, are O-rings. And those are what you use to put in to make sure that the wire goes into the bracket slot. And it's fun because you can make it different colors, or you could do alternating colors. So it's a good way for the patients to express themselves. The bottom right is for debonding a bracket. So when you're ready to take off the brackets, you just put it on the bracket, you squeeze tight, and then the bracket pops off. And so that's what we use when we are debonding our patients' brackets. So they're all good stuff. Please let me know if you have any questions about anything. So what is a typical day like? So right now, as an orthodontic resident, I'm going to tell you about my particular day. I don't know yet exactly what it is to be an orthodontist yet, because I haven't personally experienced that, but I have seen it. So every day I go in to Tufts, and we have our own scrubs there because of COVID. They don't want us to wear. So we pick up our own scrubs, and then we change into our own the scrubs that we picked up. And from 8 to 9, we have a resident case presentation. So each one of us will present a case that we have, and we'll all discuss what we think about that case and how we would particularly treat that case. Sometimes every single resident is on the same page, and sometimes some residents have different ideas on how to treat that particular case. So you really learn about different aspects of treating cases, and also you learn about how there's, in orthodontics, there's many different ways to achieve a certain outcome. And so from 9 to 12, you're seeing patients. So it can range from initial consultation where a patient comes in and wants to see if they would be a good candidate for braces, Invisalign, or they've been referred from their pediatric dentist to start braces. Or you could do an ortho adjustment where the patient already has a brackets with you and you're just progressing with their treatment. Or you could do a consultation or a treatment consultation where you go over with the patient what you want to do for their particular treatment, and like you present also different treatment options for that patient. We also have, we go to lunch from 12 to 1, but usually we're not having just lunch, it's a lecture inside. So we usually have either a faculty lecturing about a particular topic or another case presentation during that time, but it's usually another lecture that we're just eating during that time. So it's really jam-packed. It's a lot of learning in a short amount of time. And then from 1 to 4, we're seeing more patients of that same type of appointments that I was explaining. It's really fast-paced, but it's also really fun, and it's something that you're just excited to learn because it is your rest of your career and you finally are there. And then from 4 to 5, we're uploading photos that we've taken, progress photos or initial photos to our software, and then we're writing notes for the day, and all just hanging out, and all the residents are talking about different cases that we saw that day and sharing. So it's a really good experience in residency. And so one of the things that I thought was interesting was discussing with parents the proposed treatment plan. That was a learning curve. So learning how to use layman terms versus terms that we use as orthodontists. So that was something that was difficult at first, but you learn that really quick, and it's something that you pick up really fast. And then during that treatment consultation, you want to discuss every aspect of that treatment with the parent or the patient. It's better to discuss that from the very beginning than to be like, we're going to do something this now, and then they're kind of skeptical about you, and then they lose confidence because you didn't initially tell them you wanted to use class 2 elastics, or you didn't initially tell them that you want to do more expanding. So that's something that you really need to learn, and you'll definitely pick that up very quickly when you start residency, or even as a general dentist as well. These are things that are very important to discuss, because once you discuss them in the beginning and not instead of the end, you look way better and you look more competent as well. Okay, so let's just dive right into some cases. So I want to initially say that because I'm an orthodontic resident at Tufts, none of the pictures I take are owned by me, so I can't use any of my cases, but these are some great cases that I saw, I looked up, and I thought we should talk about it and we can discuss. So this patient comes into your office. It's a 12-year-old female. She reports no significant medical issues, reports no habits, and it looks like this. You look in the mouth, you talk to mom, and what do? So what do you see first? For me that jumps out is that I see a crossbite. You see these upper lateral, all in cross, and actually the upper incisors in crossbite as well. It's kind of very constricted. The maxilla, which is the upper jaw, is constricted to me. So what is something that I would want to do to correct that immediately? Well, this patient needed expansion. You could see that here, her upper palatal width, or upper 6 to 6, which upper molars, are very constricted and smaller than her lower 6 to 6 or lower molars. So we need to expand that palate in order for them to be more, to be able to more occlude better. So this patient got an expander. So usually the orthodontist it depends the type of expansion you need. But in this case, I'm assuming they did one or two turns a day for 2 weeks. And that's when you bring them in and you assess expansion. And then you reevaluate and you then expand more and go for another 2 weeks, depending on how much expansion you need. So for this patient, you see this nice finish. You see that the maxilla and the mandible, the upper jaw and the lower jaw are better coordinated. And you see that you're now looking at the upper jaw being more on the outside than the lower jaw. And so that is something that you want to see. Usually when patients present with a crossbite, there's something called a shift. I know I might be getting ahead of it, but that is something that you want to eliminate immediately. So please let me know if you have any questions about this case. And you could see here in these photos that the upper jaw, if you look at E, you can see that the upper palatal width is now bigger than your lower 6 to 6. So those smaller called sixes, and they're larger in width than your lower molars. I'm trying to see. So now you could also see this particular patient got bonded lingual retainers. Some orthodontists love to do that and some don't. When you work with faculty at your orthodontic residency, some love it and some don't. So you kind of pick up and you get a feel of when is it an appropriate time to use it and when it isn't. When there's a lot of crowding, it is appropriate because you just don't want, you want to prevent relapse. You want to prevent those teeth to go back to the initial position. So in this case, the orthodontist thought it was a great idea to put, and I think so as well. So then let's talk about this next case. So this 8-year-old female came into your office and this chief complaint says, I want to fix my bite. She reports no medical issues. She reports, and you notice no habits. She has something called the class 3 occlusion, where her lower jaw is protruded more than her upper jaw. And what do you do? What do you do for this patient? You can't let this patient live like this at 8 years old. She already is showing a protruded lower jaw, and you can't even see the upper incisors. Let's see what else from this. From her profile, the parent is probably saying, I don't love my daughter's profile. So that is something that you can fix and you can alter as an orthodontist when you have growth on your side. So this patient is 8 years old. She's a female. She is still growing. So this is the perfect time for you to be able to see this patient. And good thing that you the parent brought in this patient at this time. And then when the patient's 15, when you're limited to the amount of things you could do as an orthodontist and alter the growth. You could see in this lateral ceph that she is in mixed dentition, and you could see that her lower jaw is called a low angle, and that's because the mandible is it looks like a right angle, and it's protruded a little bit, and you could see she's having a deep bite. So this is her upper incisors, here are her lowers. So instead of occluding like this, what we want to see, she's like this. So we need to correct that for this patient. And my guess is that she's hitting right here and then she's shifting. So we need to eliminate that immediately. So what I would do, or most people would do, is something called the face mask or a reverse pull headgear. And you can see that in this picture with the blue face thing. So what you do is that you attach something that probably has a Hyrax expander on the inside for stability in case you want to expand. And then you have these arms that come out to your primary canines. And what you're going to do is connect those arms with rubber bands to the face mask, and that's going to pull your maxilla or your upper jaw downward and forward. Sorry, there's I don't know if you could hear the fire truck, but that's going to protrude or move your maxilla, your upper jaw downward and forward, and that's going to correct the underbite, and that's going to correct the class 3 malocclusion. You're able to do this up until research says to 10 years old, when the sutures ossify. So you want to so this patient right now is 8 years old. So you really want to make sure that you get this patient in and you stress the importance to the parents that this is a very important thing to start right now and not wait and not say, oh, we'll start and when all her adult teeth come in. No, you need to start this procedure right now. And so that they understand that you could manipulate growth and for your favor and the patient's favor as well. So let's see. So you could see the after, you could see the profile is much better. She has, before she was mid-face deficient. So you could tell that in her mid-face, it was kind of further back. And then in this lower profile photo, she has a great straight profile. It looks really good. So their objective of achieving or eliminating the crossbite and eliminating the class 3 skeletal pattern for now has been achieved. If this patient did not receive this treatment at this time, there's other options, but then another option would be surgery. And that is something that you will discuss with the patient from the beginning. Like I said, you have to discuss all aspects of the treatment from the beginning. So something that I would discuss with this patient, yes, we achieved what we wanted to achieve, but there's always a risk of surgery if your lower jaw continues to grow forward. And that is something that you need to stress in the beginning because you don't know how much this patient's lower jaw is going to grow forward but you can also suspect, let's say she comes in with her mom who has a big lower jaw forward. So you could tell that it runs in the family, it's genetic, and it's something to plan for as well. All right, let's talk about this third case. This patient is an 18-year-old male, and his chief complaint is, I do not like my profile. He has a high angle mandible, so instead of that right angle mandible that I explained before, it's something on a high angle. He has an increased lower 1/3 of his profile. It's larger than normal, and he has a protrusive lower lip. What do you do for this patient? How do you help him? How do you make his quality of life better? So for me, I would assess his growth. Is he done growing? We need to know that. So you would take a series of lateral steps and see, and it's called superimposition. You put them on top of each other and see if he's still growing. That is important in this patient. Because he's 18, he's towards the end, but he's a male. So there's always some growth spurts at the end that you worry about. But because he's 18, it's something that he's towards the end of his growth. So what do you do for this patient? You can't do the face mask like we talked about for the last patient because the last patient was 8 years old and that suture ossified. So we can't push the upper maxilla forward, right? So what do you do? There's something called camouflaging where you could extract some teeth. And there's another option would be surgery. And with surgery, you might also have to extract some teeth depending on the treatment, depending on the case. So before surgery, you line up the teeth, you put brackets on, you decompensate. So you want to tell the patient from the beginning, your teeth will look worse before surgery because then we'll make it look better. But you have to make it look worse before it will look better. So before it was probably cut into something like edge to edge, something like this. And then right before surgery, you are decompensating. So you put the teeth where they need to be. So the teeth will be like this, where they need to be. And then the surgeon, you'll be talking to the oral surgeon as well, will increase the maxilla and then set back the mandible depending on the patient's needs. In this case, he probably had bi-jaw surgery. So they probably, like I said, move the maxilla forward and then set back the mandible. And then you could see before surgery how the teeth don't look like they will come together, but you are taking a series of scans and impressions and then manipulating the teeth so to make sure that they'll be able to right before surgery. You want to make sure you have everything set before going into surgery, because once you go into surgery, you're not doing surgery again. It's very difficult to do surgery and also to convince a patient that they need surgery again. So you really need to make sure you get it right, because surgery is serious and it's not like you're just moving teeth. You have to, it's invasive. So this patient, I think, has a really nice finish, has great overjet and great and slight overbite. And he's probably very happy with his profile now that his lower jaw is not way forward. And he probably had like something called a concave profile. And now he probably has a straight to convex profile. So it's something very beneficial to these patients. So these are all types of cases that we get to see every single day as an orthodontist and to treat. You know, most cases as an orthodontist, you've seen them so many times that you're going to be able to treat them and you'll know right away what you're going to do. But there's always times where you might not know what to do. And that's okay, because you're usually going to be part of a study group that you could discuss the case with your colleagues. And there's going to be times where those cases stump you, but you have your support team, and I have my co-residents, and we get to discuss these cases all the time, and it's really fun to learn. So yeah. So like I said, for his profile, the lower, he had a protruded lower lip, and he kind of is just it looks like he's just a very strong jaw. And in the post, it's like a very beautiful profile. I think it was a really nice case. You could see that his lower lip is more back than his upper lip. On the post. In the pre, it's the opposite of what it should, and it's less aesthetic. So please let me know if you have any questions questions. I'm happy to answer anything. Also, follow me on Instagram, and you could always message me. I'll try my hardest to answer any questions that you have on Instagram. And yeah, thank you so much for having me. I'm happy to answer any questions you may have.
Thank you so much for taking your time to talk to us about your profession. It's truly appreciated, and I know that I learned a lot from your presentation. So we do have a few questions. The first one is, could you share with us how you studied for the DAT?
Yeah, I would love to. So I took 2 months. So I took a 2-year gap year. In my first year, I took a course. I feel like it was like a prep course. It's not the Kaplan. It was something that was near UCLA. And I took that course for maybe 2 months. And then the third month I studied by myself. So I took, I think, around 3 months, and then I took the DAT. I was fortunate to be able to take those time studying when I didn't have other classes, but some of my colleagues didn't have that opportunity and took those courses or took the DAT during undergrad. It's kind of it goes back and forth because your DAT is reflected on your prereqs. So a lot of the things about prereqs that I kind of forgot. I had to reteach myself during my gap year just for the DAT. But then I had a lot of time to teach myself it. So it's kind of like a trade-off of what you think. I would say you need 1 or 2 months at least. So for me, I was able to take 3 months to study for the DAT.
Okay, that's perfect. Thank you. And the next question is, what is the most hardest part in organizing dental campaign or service trips, and how did you plan those or make it successful?
So I wasn't the head of it. I was one of my first year I just got to go, and then the second year I helped organize it. Usually the dental school that you go to will have something that's already kind of set up. So yeah, I was kind of fortunate that way. And it was kind of all set up, and I just had to go and I helped organize and help market because we had a fundraise, and that was my kind of position my second year. But I don't know how to organize it, but if I were to organize it, I would say start small, like start very small, because a lot of things come up and those trips are very difficult. Like you need permits to take x-ray machines. You have to take your own mobile x-ray machines. What we were doing is we were in like a parking lot of a school. So we had to bring all our material, every single material. We had major luggages with us. So I would say, before they started very small, and then they got to about 50 people on each trip. So I would say, if you were to plan it, like I said, talk to research who's done it, ask them how they've done it, but then make it very small scale and do it that way.
Thank you so much. The third question is, what was your motivation to pursue a career in orthodontics over other healthcare careers?
That's a great question. I initially thought I was going to go to med school like my brother. And then I saw my brother is 7 years older than me. And then I saw him doing residency, psychiatric residency. And I was like, I don't want to spend this much school and then do this much residency and then this much fellowship to pursue a career. And so then someone suggested dentistry, and I shadowed, and I was really fascinated by it. And I thought that, and a lot of people think that the mouths are disgusting. And then I was like completely opposite of what I thought. So for me, I pursued dentistry because I was kind of timid of the amount of years that medicine was going to be. But then it's funny, now I'm doing residency. So it's kind of the same amount of years almost, but that's something that I'm passionate about. So it's worth it, I guess.
Yeah, you're absolutely correct. So the next question is, just wondering, can you clarify what you mean by orthodontic selective?
Okay, yeah. So at your dental school, you'll probably have something called, basically, like, the top of your class will be selected to be part of something. So for ortho, I was the top in that ortho. So I applied and I got in to be an ortho select. So that's basically the top students that want to pursue something, they get to be a select, and they get to go to like seminars that further dive into that topic. So I was also part of the pediatric selective, where we discussed, it was like additional lectures that were not required, and I would go and we would learn pediatric dentistry. But that was something that was interesting to me because I was already in ortho, but it was something that's so close to orthodontics that I wanted to learn about pediatric dentistry as well. So selective is something that my school offered, but it might be called something else at a different school.
Okay. The next question is, from case 2, why are you more limited in treatment choices if the patient came in at age 15?
Okay, great question. Let's go back. So at age 15, you are limited. You're limited because there's a suture posteriorly so when you're pulling on your maxilla or your upper jaw through these rubber bands, through this face mask, you're pulling on a suture back here. Okay, so you're pulling forward to elongate the suture, to deposit more bone, to elongate it. So you're getting out of crossbite, and you're positioning the maxilla in front of the mandible. So when that suture ossifies, or it integrates, or it basically stops growing, and you can't alter it by the age of 10. So when you're 15, you're limited because you can't use growth in that aspect. You could use something called bite plates, not bite plates. Excuse me, I'm totally blanking. You could use other aspects that don't play with. So this is something that's really good from at an early age, and you want to eliminate it because it's less invasive. Like, you're just basically using a rubber band to these hooks to pull your upper jaw forward. But there's other. So if we didn't do anything and she comes to at age 15, she'd probably be a surgical case. And she definitely probably needs surgery. And then as a female, you have to wait till surgery until you're around 17 or 18 because you're not done growing. So you don't want to initiate surgery too soon, because then will do surgery, and then if you're initiate it too soon, then you'll grow out of that surgery occlusion that you achieved, and then it would be another surgery. So it makes no sense to do that. I hope that makes sense. Please let me know if it didn't.
Yeah, it did. And the next question is also related to case 2. It's asking what causes the protrusion of the lower jaw?
It could be a lot of things. So it could be growth. It could be the way her teeth are erupting, that it's causing the shift. Like I said, you remember it could be like this, and then all of a sudden it shifts. So then her upper teeth go inside. It could be something called vertical. So there's a lot of ways. It also could be genetics as well. So there's a lot of different reasons for this malocclusion.
Okay. Do you think dental school prepares you enough for the real world?
I had such a good experience at so I can't speak to every dental school. I thought my dental school was a great experience, and I think it prepared you as much as we could have got experience. I think that you'll learn a lot more out of dental school, but I think as for dental school, I was prepared to go out and practice as a dentist if I wanted to. I didn't want to. I wanted to just do orthodontics. So I don't think that I wasn't worried. I thought that USC prepared me really well, and it prepared the students really well. But I think that there's something where when you're thrown into a situation to see how you react. And so I think when dentists after dental school get thrown into real world, you got to learn, you got to be quick, and you have to adapt. So no matter what, if dental school teaches you or doesn't teach you, you're going to learn once you start practicing. But I was lucky enough to go to USC and have a great experience that way.
Okay, that's great. The next question is, what resources did you use to write a really good letter of intent to get into dental school?
Good. I'm glad. Or letter of intent to get into dental school, or letter to get into orthodontic residency?
They stated a letter of intent to get into dental school.
Okay. So when I replied, I think it was letter of recommendations. What research? So it was a while ago. Wow, it was like 6 years ago. So I used the dentist that I did a lot of shadowing for. I used him as a resource. And he was like a very high up dentist, so I wanted to make sure to use him. I thought that was going to look good. And then I used the courses that I did well and I excelled in. I asked those professors if they would write me a letter of rec. For orthodontic residency, I remember it more, so I could talk about that too a little bit. You need to get a letter from an orthodontist. That's like one of the requirements. So you need 4 letters of recommendations, or they're not letters of recommendations. They get to just fill out on the portal a series of questions. It's like 1 to 5, like how responsible is this candidate? And so it's not a letter, which I thought going into the process was, but so you have to have 4 of these. One of them I got from a course that I was excelled in, and I was a teacher assistant. One of them was someone that was an orthodontist that is a mentor to me. And then 2 other, I think I got another orthodontist just to show that I really was interested. And then another faculty member that I was really close with and I had a great relationship throughout the years with. So you need 4 letters for orthodontic residency. I don't remember for a dental school. I'm sorry.
No, that's great. That's perfect. What to you is the most rewarding part of the job as an orthodontist?
Let's see. There's so many different things that I really like. I really think that the connection you make to the patient is really rewarding. I think that building that connection with your patients, seeing them grow. Like today, I had a patient that we talked about the last week that she had a test, and then this week she found out she had an A, or last month she had a test, and then this month she found out she had an A. And then, so it was like a very fun bonding experience, and we get to share fun things that are going on in the patient's life that is really rewarding. Another thing is you're really changing someone's life and appearance. So like in this dental case number 2, imagine if we didn't alter this patient at this age. Like how do you think she would be treated by her peers? You know, these are things that are quality of life is changed. If she might be teased, you know, a stronger lower jaw on a female is considered not aesthetic. So I think knowing that you really do have an impact on your patients' lives every single time they come visit you is something really rewarding. So that would be my answer.
That's great. And the very last question we have is, do you have any advice for international trained dentists who are seeking to pursue dentistry in the US?
Oh, I don't know about it too much, to be honest. I know that USC has a 2-year program and then it would take dentists from international to and it's a 2-year Excel program to become dentists. To be honest, I cannot talk about, I don't think I would give the most reliable answer to that. So I don't know. I'm sorry.
That's fine. That's okay.
Yeah.
I just want to thank you once again for taking the time to talk to us today. And to our viewers, I just want to remind you that we have a quiz today that will stay up for 24 hours. You can find the link in our Instagram bio. And I hope everyone has a great day.
Thank you so much for having me. This was great. I had a really good time. Thank you.
No problem.